Yes,
Dr.
we are.
Kelly? And you're in Perth also?
Yeah.
I wasn't exactly sure. Dr. Aurora, you're in Perth also?
Yeah, Fremantle, part of Perth.
So we're live from Perth, Australia, and in the north of Israel. And it's 5:30 here in the morning and 10:30 in Australia. And I'm very, very honored to the internet to allow me to do that. But I'm more honored to be with these two amazing ladies and be talking about health and healing chronic pain and autoimmune symptoms, which is Talia's. And then when I met Dr. Aurora, I thought another devoted, loyal woman helping people to heal, to help heal themselves. So today's topic is one I'm not so familiar with and yet fascinated by, and I know a lot of people have been healing. And Dr. Talia introduced me to Dr. Aurora, and that's how this little morning breakfast coffee clutch came about. So Dr. Aurora Sheehy is a Chinese medicine practitioner, and you'll explain that.
Sure.
But your interest is more in herbs, which is fascinating, because does everyone know that, you know, medicine came from herbs? I mean, they'd go out in the garden and the doctor would pull some green and put it in a tea and give it to his patient. That's where most of the medicines are made of herbs. And then they got less and less herbs and more things that maybe are not so healthy for the body. But that's where the original, when I studied in the Jewish history, you read about, you know, many of the doctors giving herbs. And fascinated that your interest took you to the nervous system. And that's really what excites me. So I'm going to be quiet. I can be quiet. And I want to hear from you. And what I'd like to know is a little history, a little timeline of, you know, started studying and then you got into this because something in your family or something happened, like a little timeline to bring us to the present moment of what you're doing and how you're helping others.
Sure. This is roughly my 20th year of practice. I started studying natural medicine in Tasmania. I apprenticed to some fairly well-known naturopaths as a very young person. And then I went on to formal training in naturopathy. And it was cases I had a few women I was supporting in a pregnancy that meant that I needed acupuncture. I found acupuncture and completed that training. And I went to China to work in the hospitals there to round out my training. Wow. And then came back and established my own practice. And it was during that practice, life happens to us all. I had come from a fairly hard place as a young person. I was out of home by 16 and supporting myself through all of that study because of, you know, some of the exposures to trauma that were there. And it repeated, as lots of people's patterns do, trauma finds you again. And
I like it. Say that again. Trauma finds you again. Does that mean we attract it because of the trauma, or it just finds us?
So I really find it so hard to suggest there's any blame in the victims. I can't. I know people say you choose your parents and I really can't accept that. I can't hold that. I think that there's probably some epigenetic selection that's going on, but really I can't accept that people choose what happens to them.
No, and there's never a blame. I think I say it in the terms of, if we can be responsible, then we can heal it. It's more like if we can respond to it in a way that's a different topic about the trauma. But go ahead. So no, because for example, I mean, like I hate conflict, but I keep attracting it to my life. So there's something there that, like, I must be getting better at it or something, you know, something like that. But it's an interesting topic. But the trauma, so you yourself having trauma in your life, drew you to certain parts of how you practice as a physician.
Oh, yeah. Yeah, certainly it in some ways enabled what I think are normal human capabilities. It's just that if you experience deep trauma where nothing makes sense anymore, that anything can be, you know, the sky could be purple and the grass could be orange because the thing that has happened is so unquantifiably wrong that you are open to some other possibilities. For me, it was that maybe the training I had around pulse taking that suggested you could follow an epigenetic line could be actually enhanced and developed and understood and trusted. So it was, you know, not that I would thank trauma at all. I think those abilities are innate to all of us, but that it they opened the possibility to consider that we can trust in our body's senses and we can believe what we can perceive from another human body, and that can be life enhancing for that person and for the practitioner to see again that there is an ability to understand ourselves, even in those places. So it was from around then, probably 8 years ago, that I started my journey into understanding the polyvagal theory's implication, because it was from there that I committed to the belief that what happens in people's lives is what creates their health. So from there I went.
Is polyvagal a different term? Like if someone uses the word vagus nerve, polyvagal is a different, same?
Yeah, it's all the same.
Dr. Tali, did you learn about polyvagal nervous system when you were studying in medical school?
No, I learned about it in my yoga teacher training.
Yeah. It's such an incredible part of the body and nervous system. You think maybe you learned about the sympathetic nervous system and we're
but less in relation to, like, it was never explored in relation to trauma or life experiences people go through. Like that was more in yoga looking at.
Wow, amazing. So go ahead, Aurora. Then what?
So it was really that. So I started to develop a system of practice that I've called somatic acupuncture. So that's where I've taken some of the traditional advanced nuances of pulse taking, where you listen to a family line, and extrapolated those into looking for the dominant emotional experience and where that origin is within the
somatic acupuncture.
That's right.
Wow, I didn't pick that. That's amazing. There's actually someone teaching specific somatic. You
haven't taught anyone yet. I could, but I've developed it over the last few years. So when I'm pulse taking, I will describe for the person, depending on their level of ability to hear, where the origin of what is going on has come from, and what their body's current dominant emotional experience is. And they will be stored in places in the body. Like we all know when you're treating that people have pain in particular areas because of what they're holding there or what their response is. So the patient intake. Sorry, go ahead.
Can I ask you a question about that? Is it like, is there a specific method you're kind of using, or is it more intuitive based? Like how does that work?
Acupuncture is great in that it really allows and has a formulated structure around organs and their mental emotional components, and over time you develop a sense of the quality of a pulse indicating a polyvagal state. And so it's that you're relating where it's found in what area of the body, so what channel, and then what quality, and then you can, so I test pulses first, the radial pulse at the wrists on both sides, and I usually work with
checking the pulse here, and
first of all.
state the state of the person's nervous system.
Yes, well, strictly speaking, the intake form is all about their life experience, and then I do polyvagal assessments, and then I take their pulses. And the pulses I take first at the radial pulse, which is traditional, and then I'm looking for those channels. The left and right side usually indicate different things. So the right side I found to be more the active or the doing side of the body. So what is the body's active response, or what is its present concern in a responsive or active phase, whereas the left side really appears to demonstrate the emotional landscape where the feelings around those things are. And so I combine those and relate those back for the patient. And then once we've determined together, I will offer the information and we formulate a place in which the person is comfortable to treat. Then we have the person lie in the treatment bed, and I will assess the pulses in the locations that we've identified and gain the body's consent before any treatment that this is correct. And so I'm looking for it's a nervous system response to the tissue in the area.
Are your people that coming to you mostly in pain or anxiety or have disease?
There's all sorts. Certainly we see a lot of people with chronic pain, gut issues, because they're also part of that stress and anxiety. But it's also, I think it should be something we consider in all conditions. From my perspective, everything that happens is an expression of the information that the body is holding. And so no condition.
I want to repeat that. Everything that happens to someone
is an expression
of what the body's holding.
That's right.
Yeah.
The information it has.
Yeah. Go ahead.
Sorry?
Are you saying inflammation or information?
Oh, information, and that, yes, creates the inflammation. Very good.
So you were talking about inflammation, because I just couldn't hear if you're talking about the body's information or inflammation.
But you're so right, because one creates the other. That's right. It's so inflammation is the message that something is wrong, and that's the information that the body has. And so we think that distress is the end result, or the life of experience lived creates the inflammation. We associate it with aging and a breakdown of immunity, but also I think the lack of polyvagal regulation is a big source that's from the information that the body has.
So what's causing the polyvagal dysregulation?
Well, I think that we're designed to co-regulate, and many people can't or don't because of their own reactive state. People are generally not well held by anyone in their lives, and so it's why you see so much information around how we should ground and do yoga and really good things, but people are designed to co-regulate. That's why we say that we want to be really present. You want someone present and hearing what is happening to you. So I do that very much for my patients, because I can regulate them by doing so. Yeah. And the regulation is what is calming to the body. And that's why we try to work through their experience and offer. So I write therapeutic narratives. They're on the capsules and the teas, but obviously I really, each of them, when I have a patient, is theirs. It comes from their experience. But the concept is that if you had someone who could be really present and understand and accept your experience and your responses, you would regulate. That would stop inflammation.
Just by somebody hearing you and accepting you, already Well, you know how is that something like where where you call the doctor to schedule your appointment and you feel better?
Yep, that's right.
Talking about law of attraction or placebo, these kind of concepts that affect our nervous system.
Yeah, I think we can do without being seen and heard, but we are much better if we can. We're designed to co-regulate, and that means we're designed to have someone else reflect back to us that they understand what is happening and they hold us in positive regard despite whatever we are saying or doing, however we are responding. That's certainly the concept of holding space as a therapist, is that you constantly maintain positive regard for the person in front of you. But that is something that we all need. That's why the therapeutic narratives I write are all positively framed, because I do believe that there is nothing that can happen to you that is not something that can be understood or acknowledged or supported. People get so harmed by the concept of shame and blame, and I think these are really faulty attempts at control of life, and you can't control life. None of us can. It's wrong to suggest that you can. I understand people do because it's frightening, but none of us, we have to support our patients in believing and demonstrating their innate capability of handling anything that comes. And
so that's kind of, but I call that kind of a control. If you can accept anything that happens, and like there's a book I remember reading called Whatever Arises, Love That. Or the body and Katie work, loving what is. If we can accept what's happening, then I believe, tell me, what do you think? I want to hear your opinion. Indirectly, you are, I don't like the word control, but you are allowing it and you're not resisting. So there's a sense of a letting go that's helping you control. What do you think?
I don't think it's control. Like, I mean, that's just my perspective. I think that's more like what you said, acceptance and surrender. But like Aurora said, like we really cannot control. Like something could happen in the world, we can't. The only thing I guess we can control is our response, really.
And even that, I think we should be so much kinder to our bodies. She's responding because of the information that she has. Your response may not be ideal or comfortable. It's just that we have to make room for it. I have several really useful statements that I use. We've talked about the body as your own first child. She can't be wrong. We might not like the reactionary responses, and we shouldn't really engage with them, but making room for them is a normal. And if you had a fear response to something, accepting it is vastly better than trying to fight it. So
I like that concept.
That's so true, because we won't always respond well, and we won't always have a controlled response. And sometimes we'll have a very reactive response, and that's okay as well,
Yeah, all of it. It just, if we can hold that the body is the first child, it's honorable, it's respectable, it's lovable.
The body is like you.
Yeah.
Like the body is the unconscious mind. So would you say also, so what do you mean the first child? Like, is your first child that you should mother it?
Your own self, like your own
self.
Yeah. So you have to I think Aurora is saying, like, treating your own body, your own self like your child, and accepting what it throws out at you, and almost holding your own self. And we've got this, it's okay what you have to react to.
It's so important, because part of the work, I think, Natalia, you'll see this as you get more into the work regarding the pain angle of it, is people hate their bodies. And there's a statement, you can't heal a body you hate. What do you say about that, Dr. Aurora?
It's just, yeah, I had someone say it to me again yesterday that their body had turned on them, and it was so painful to me to, to see that pain in them when your body is your only ally. You can never be alone in the world if you are aligned with your own body. She is everyone that went before you. She is carrying 12 generations they can find in, what is that, the lab in Chicago that measures epigenetic changes. 12 generations of women are with you all the time. And you can't not love her. She's not turned against you. Your body is responding with all the information that she has. And if you can most kindly approach her or understand that that's what's happening, I get that the symptoms, this was a post-COVID POTS, that the sense of a body out of control is really scary, but that sense of being alone that feeds some of that inflammation is really not necessary. Your body is responding, and we can understand her, and demonstrating your ability and willingness to parent her kindly will reduce the inflammation. And that's what we need.
I love that medicine. That is the greatest medicine that anyone could take. So then how did it get into, so fascinating, your 20 years and the going to China and the studying and the pulses, and acupuncture is so profound in so many ways. And tell me where the nutrition and the herbs came in, like that, because I know there's a whole study of Chinese herbs, and we haven't even touched on the part of the herb world that is the essential oils, and then the smell. That's a whole nother part, which I don't think we'll talk about, but I would love to hear more about the teas, if you could show us a couple of them, and where tea is something I think people are more open to the tea, or if it was more like smoking it in a joint, people would understand it. Tea, if we can smoke it or we can drink it, well, we're open to it. From what I've seen, because
you have some really basic things in polyvagal theory about, this is the gut-brain idea, right? Is that because there is a reset nexus for the polyvagal nerve within the gut, and so people sometimes say, listen to your gut, but what they're really meaning is listen to your polyvagal nerve, because it's the polyvagal nerve that is regulating the gut.
Wow.
In my own work, I started that 8 years ago, committing to that. Fundamentally, I believe that what happens in people's life events create their health. So I had to go finding appropriate medicines, and Chinese medicine has a fundamental belief around emotions creating ill health. They have medicines, plants that are used for anger, grief, and loss. But because I have, a Anglo-Saxon background, because I think that there's so much joy to be found in uncovering lost knowledge, that I went looking for the European plant history to see how because we have and did have, which is essentially women's knowledge and indigenous European understanding of herbal medicine. And if you go far enough back, and I went as back as possibly you could go, the 6th century, there are some herbals from. There are more from the 12th century that refer to life events and plants that treat them. So there are
around healing. You went to look into the European history of herbs regarding healing.
Yes. Wow. And the fundamental understanding was there, as well as you see reflected in traditional Chinese medicine, that emotions can cause ill health. And so it was a really wonderful, fun adventure to find such long lost history to these plants. So some plants like milfoil, a lemon balm, is traditionally used for heartbreak.
Heartbreak?
Heartbreak, that's its traditional use. And I found that a number of the glycosides in it actually improve the polyvagal tone to the heart.
Wow.
So it was this wonderful connection. I think we should all seek the human insight, the traditional understanding, because tradition is those 12 generations of women that you're carrying within you.
Not to say about our eggs. You guys know about
yeah.
the eggs and how they're holding our grandparents. Did you learn about that, Talia? That
No.
That the ovaries are holding, you know, like our grandmothers.
Yeah, that's the 3 generations, because you yourself were an ovum inside your mother, and because women are born with all their eggs, so you were inside your mother who was inside her mother, which means you were physiologically present to your grandmother's life.
Unbelievable.
Yeah, I think it's really,
Talia,
it's really wonderful.
I wanted Dr. Ward to go on, but I love the connection that how you met Dr. Ward. Did you go to her clinic and get to tease?
I was just doing some research on the internet and then saw the teas and found that the messages, what do you call them, Aurora? The
therapeutic narratives. Therapeutic narratives. That's what they are. They're a treatment in themselves.
Yeah, exactly.
And the little messages on the tea, on like their little messages here.
Oh no, they're quite long. A number of them. This is the love and light one that we use to promote self-compassion. It has in it the lemon balm that we spoke about.
About the heart.
Yeah, because it improves the polyvagal tone to the heart, and it's traditionally used for heartbreak. And heartbreak is, you know, the harshness of this experience, particularly when it's unsupported. So I can read you the therapeutic narrative if you want.
Yeah, but let me ask you. I would like. I'm just curious before you read that one. I want to hear.
Yeah.
Is like, do you have one for anger, for fear?
I
would love you to read the one. Really, I think because regarding chronic pain, there's so much fear or doubt involved, and I would love to hear that one.
Yeah, no, any of them. Overwhelm we use because that's the first polyvagal state of shutdown.
Wow.
So we use the overwhelm formula really often. And in pain, we do have a pain formula, but you'd often give them the fear and the overwhelm first, because
are they tea bags or they're herbs?
Yeah. Like this.
Wow.
So there's your tea bag, and you've got your little heart. And if you're really lucky, you get a heart-shaped cup. See?
Did you purchase these with Talia? Did you go see Dr. Aurora personally?
I didn't go see her for a consult, but I went to the shop and purchased. That also comes in loose leaf. So I have some loose leaf.
Yeah. So. That's right.
Wow. So go ahead. Can you read the one about pain or fear?
Yeah, any ones you like, Sweet Pea, is perfectly good. I'll try and get it so you can you see it?
Yeah.
Can you see it like that?
Yeah, a little bit.
No. I can just no. Okay. So it's Oh, the surrender one is also really good. So it says, so anxious these thoughts, over and over chasing you on. Know that at this moment you are safe from your fears. This world can be such a hard place. Kind hearts crushed every day by harsh and thoughtless actions. Yet fear is a punishment all of its own. Fear is a prison that will keep you forever. Take my hand and step away. Leave the fears behind you like the ill-fitting clothes that they really are. This is fear and freedom.
Wow.
Beautiful.
Can you read another one?
Yeah, sure. You want Love and Light?
Yeah, anything. Just, I love to hear you read it. They're wonderful messages. They're affirmations.
Yes. But I think sometimes affirmations are toxically positive. You know, like I really think that they can miss hearing and acknowledging the depth of how someone is feeling. And so I didn't, there's loads of them. I could have just, but it's how do we deeply relate to each other without sharing of our own experience? I can't co-regulate someone in trauma without telling them that I know what it's like because I've been there. No one can regulate you if they don't share your experience. That's the reality of it. So I am in some ways grateful for the depth and breadth of my hard experience, but yeah, I really think that's the core to stopping inflammation, is being as purely honest as you can about what has happened and what is possible still in that space.
I think that's why EFT has been so successful. I mean, just what's been going on here, there's just enormous amount of EFT sessions going. And I know my own daughter, who's a bit triggered by what's going on here, is constantly, and what the EFT is, it's beautiful because they validate, like, it's not like, oh, everything's going to be fine. It's more like they validate the EFT, emotional freedom technique. They validate, I know that you're upset.
Yeah.
And it's like, that's where we all kind of went wrong as parents, because we didn't validate our kid. What do you mean you're upset? It's okay. Everything will be fine. Go into your room, as opposed to, oh, you're feeling scared. I didn't do that as a mother, and my children teach me that now. They want validation. So it's chemical. It's what you're talking about. And that's what you're doing on the teas. You're validating. First, the reality. It's not a pretty reality. It's, you're hurt, you're angry, you're fearful, you're doubting. So even though, I'm doubting, even though you're doubting your health, even though you're feeling angry, it's okay. Like, so I really love that you're incorporating that, because I think it all comes back to a similar poor reality.
Because I think with affirmations, it's kind of talking over the feeling rather than like really being with the feeling. It can be a bit just like, I'm really calm, but you're not actually feeling really calm. So there's a step missing probably. And just on that tapping, it's interesting. Some people love that so much, but I find that tapping frenetic and anxiety provoking in itself. So it's just so funny how we're all so different.
I don't really benefit from it personally when I'm feeling stressed. Yeah. But my daughter's, it's so popular. I think it's neurological.
Sure.
So, it's neurological, whether it's the acupressure, acupuncture, massage, it's somatic. And it's like you're getting in a little bit of a trance. So I think for certain people, it's effective. It's not so effective for me. It's not something I'm gravitating towards personally, but it's interesting about the saying what's wrong first, like validating the trauma. That's first. Yeah. That's so interesting. So that's what you probably learned also in your work, Aurora, it just comes natural for you because it just didn't come natural in the beginning days of my practice 3 years ago. It wasn't a thing. It was like until the parent books came out, and that we had to validate our children in order. And I was surprised how people feel better when you're like, yeah, I do feel. I'm thinking it's working. Like, I don't understand the depth of it, but it's something I think neurological. That's what you're talking to me about. That's what
we all want to be like heard and just understood and accepted. So that includes our feelings.
Yeah, very much an experience.
100%. So and so tell me about the teas, because I also, I lean more towards like a placebo reaction. And there are people that I know, that some clients that are just trying so many things to heal their deep trauma, and which turned into chronic pain or disease symptoms. And I think nutrition and herbs would be an incredible road for them to walk, because it also is belief. These herbs, this tea, will make me feel better. Like I'm ingesting this. And there's an emotional relationship with what I'm drinking, what I'm taking. And I mean, but you're saying, if I'm not wrong, the actual herbs are affecting our nervous system. Does the person believe it, or it can be like they can just drink? No.
Yeah, no, I don't think there's any impact on the action of the therapy of herbs by whatever the person's thinking. It makes no difference because they're acting physiologically. So that's not impacted by whether or not they're having faith at that particular moment.
Wow.
Yes, I don't agree. I actually feel like if we there's a million perspectives out there. It's interesting just to have a discussion. I feel like if there's a resistance in us, like I really don't want this, and this tastes disgusting to me, or like poison, and we're putting that onto the whatever it is, then we won't have a positive reaction. I really feel like
but I'd consider the resistance something to treat. That's not that the plants aren't working, it's that you've come across resistance. So we go, great, time to treat the resistance. And sure, I understand that may mean that someone says, I can't take capsules, I can't take this, and that's okay. So we may have to revert to a non-ingestible form like somatic acupuncture, or maybe they feel okay with, like it's like a conversation. If a child was reactive and wouldn't eat to this or take, you just find a way around it. It's not a problem with the substance. It's a nervous system based response that we should care for kindly. And maybe they're not ready to believe, I have to be really always present to where the person is at. How can I explain to them in a way that they can hear what is happening in their body? And that's the same here. I get that if people don't want to do something, then they won't. But if they were coming for help, I would consider that a useful thing also.
Yeah. I think it's a whole discussion about food and nutrition and medicine and the whole relationship with, like what you said. And it's fascinating because food is medicine. Herbs are medicine, and our bodies are being toxed from the inflammation, and anxious thoughts create inflammation. Anxious thoughts change change the nervous system. Being in fight or flight is a chemical reaction out of protection. So I think it's also probably an education that you see. The beautiful thing is you aligning yourself with a more nutritional approach as well draws people into, the herbs and nutrition. I think you could educate lots of people. I mean, I would love if I did anything else. I mean, I think nutrition is important. I think what we eat is important, and that this is a whole nother, topic of discussion about what we eat. And anyway,
and the information that they are, that I think it's very biochemical. The food that we're taking in is information.
It also really depends on what you're dealing with, because if you're dealing with someone who has no nutritional knowledge and they aren't really eating the right things, or they do have a lot of unhealthy things and they just aren't aware, then of course that's going to have a huge role, right? But then if you, on the other hand, dealing with someone who's doing all the right things and their nutrition is like perfect, or close to what you think would be a really healthy diet for a lot of people, and they're still having a lot of other symptoms, it's probably not the nutrition. So I think it's always like we always have to have such an open mind to, yes, nutrition is globally important, but it's not the be all and end all, because I've seen so many people on their healing journeys, so many be put on the gluten-free, sugar-free dairy-free diet, and they may not have needed to be on that, causing the problems. And then the fear, oh my gosh, what happens if I have a touch of gluten when they don't have celiacs or anything? That can actually cause problems. So I think we have to just be so mindful of never saying anything like, oh, nutrition is it, because for a lot of people, it's actually not it.
No.
So it's always the, the big picture, I think. Anyway.
Certainly as in my naturopath training, so much was around diet, and I have come to my conclusions that I think it has very little to do with food, what is happening. I think that food choices are a polyvagal representation. I think food responses are polyvagal representations. And I always attempt to guide people towards a good, healthy way of eating, but I really don't think it's because of food, what is happening in their bodies.
But what we eat does affect our nervous system.
Yes, but what people are choosing is because of the state of their nervous system as well.
Wow. Can you explain that? That's so interesting.
So basically, your brain and nerves run on sugar and fat. So people in fight and flight or who are cortisol deficient will be looking for things to keep them going. And we should honor those choices for what they are and work to improve their nervous system regulation and support them into making better choices. A nervous system is so fundamental. Yes, of course, there are inflammatory foods, and I have seen people in chronic pain respond to a program that reduces inflammatory foods, but that is a really small part of what we do in this type of work. It's not caused by foods. And I see also a lot of people, on that gut journey, Talia, you must have seen it, people go in search of the one pathogen that's created this terrible gut thing, and they take all these horrible things that kill them, and they can be antibiotics or oregano oil or equally dangerous and damaging things. And it's nothing. It's none of those things. It's nothing that cannot be at least a lot of part addressed by supporting and caring for that body and that nervous system. So many people in such hard places being told to do such hard things. It just seems so cruel. And it's also, a very expensive rabbit hole to send people down to go in search of this one thing that will cure them, which is, as a holistic practitioner, is the antithesis of what we do. There's no one thing. You are expressing your whole experience.
And just the thing on that, like so many times, like if people, like all the complete microbiome mapping and things that you can go and look at everything so acutely, that same profile might be in another human being who has no symptoms.
That's right.
Because it's more like the dysfunctional relationship or the trauma or whatever's happening that's causing symptoms than a little parasite that maybe would go in its own time. And then they retest, and then they take more paramycin. It's just,
and when
I might do that a lot,
it's just awful because certainly, it gives, I think, naturopathy a bad name, the suggestion that you can find this one thing when there are more bugs in the gut than there are stars in the sky, and they can't treat all of them. That they have improved their assessments, but they're still not, they don't even know what genome sequence to test for or what each one does. It's not possible. And then they don't have an understanding of the relationship of those things. You have some people promoting a specific probiotic for a specific thing, and it's, that they each have an action, but it's still, where is the whole? And the nervous system response in the gut is going to regulate the inflammation in the gut anyway. So
do you think the source, the root, is the nervous system?
It's what happened. That's the thing. The nervous system is responding to what happened. And we have to determine what it was that happened and treat that.
Okay. So what happened is past and present. And then whatever happened, the nervous system's responding to that, and it's regulating or not regulating.
Yes.
And that's where you begin to help people help themselves.
Yep. I understand that, you know, all health pictures are complex, but my firm belief, this is in which the way I've chosen to practice, is that I look for the cascade of life event that activated or created this nervous system. Obviously, nervous systems are born reactive, you know, and that means that you have to consider the potential for transgenerational trauma having an effect. It's not like it's, you know, there's one thing that does it. But I think the dedication of the practitioner should be to work through the layers or the presentation of those responses and the information that is driving those responses.
Right. Well, it is so interesting. It's so beautiful, the wealth and depth and girth of your practice and how you're treating people and how you can help people from different, and that you have a focus, like you want to know where they came from, how they got here emotionally, neurologically. Wow.
And I think they are treating, if you can locate the response or the experience information, then we just need to identify it and make it something we can acknowledge. And you can take the inflammation out of it. And that may take time, and we need to have a good therapeutic relationship to make that possible. But that is what we should be endeavoring to do, in my opinion.
I wish everybody could have a therapist like you at, you know, on call, like sitting in the doctor's office. I mean, you know, just like Dr. Talia, who left the medical world. I mean, there is a lot of conflict with people who came from the medical world, not getting what they needed, still believing in the medical system. It creates more co-regulation.
Yeah. Well, it sounds as like a lot of hostile environments. There's no attempt to regulate. You know, in hostile environments, the whole concept is to destabilize each other so that, you know, the individual perceives they have more advantage. That's competition. That's not cohesion or collegiate relationships. And that's not natural to humans. We should be ideally collectively working to solve problems.
And the same idea, like I recently wrote an article about this, like the doctor knows best approach, where the doctor will tell you your treatment plan. I mean, that's so outdated, but that is primarily how most mainstream doctors still operate, I think. So it's such a tricky one to change the whole culture of medicine to this more collaborative, well, here's some of my knowledge, but let's work out what works for you. That is very rare. And also patients resist that too, because
it's true.
They think, what's this doctor telling me I have to choose? What is wrong with this doctor?
But so I'm going to interrupt. I'm sorry, go ahead.
Oh, that's the concept that people don't wish or don't feel comfortable with being responsible for their own health. So the orthodoxy method has succeeded in being popular because it takes responsibility from the patient. And the philosophy, from my understanding, supports this notion that we will all get sick and die, and you must just manage as best you can along the way. And there's no sense and a need that we should attempt to completely address causes because we are in this management. And I don't suppose understand, it's not my background, but what I see of why it works or why people might appreciate is that we want someone to take the burden. Tell me what to do. I don't want to have to face it. And that's a really normal response. We should understand that and also seek to support it, because they don't have to be wholly responsible, because responsibility can sound like blame and shame, and where you go to the doctor
and pressure.
Yeah, rather than, you know, you and I might want to empower our patients to see that whatever is happening, there is a understandable reason for the body's responses. And if we can hold that space of kindness and track them back, we'll be able to acknowledge and get into that. And it's not a scary responsibility. It's an enlivening of your capability.
I love that. Hold that, because I want to ask, I want you to say that again. I want everyone listening. I mean, 3.5 years now, I get people from the YouTube saying, I listen to your YouTubes and I'm healing. And I'm like, please God, continue. Like, I bring these amazing people like you on, and you just enlighten my virtual studio with these kind of insights where everyone, and say it again, everyone can heal. There is a reason, there is a cause, there is a cause.
Yeah.
Because the people who are getting better from the medical system are not listening to this broadcast, because they're getting better from the Advil or from the steroids. They're getting better, and that's good too. And medicine has a place. We're not here to negate medicine.
No.
For people who
that's not the point.
Medically unexplained symptoms, chronic pain, autoimmune disease, which is not responding to the conservative, like these are and this is the majority of people. There is a healing. You can heal. There's no negotiation. The body can heal. It wants to heal. And you are the doctor and you are the therapist. And we are here just to shine that light and say, take the ball. We're here to hold your hand. You can heal. So please say that beautiful statement again. I love your language. It's not my language, but I love it. Say it again, please, what you just said.
I made it up on the spot.
About there is a cause for, like, there's always a reason.
There's always a reason. There's always an understanding you can hold for the body's response. And if we hold the body kindly and track it back, you can heal that response by being present to it, by understanding it. You can be empowered to know yourself better and in a more respectful and honoring way. What's happening is a consequence of what has happened, and it can be addressed, and I believe almost always can be treated.
Wow. So I know we're gonna round up soon because Dr. Talia has to go, but what would you, in your experience, Talia, this is your third time on the show, and I'm so happy to be sitting next to you also, and what would you like to leave with the audience, like a kind of what can someone do today? I love these sort of take home so people can feel empowered. That's what we're doing. We're empowering people to look inside and to understand a little bit, to be educated about their nervous system. They don't need to be doctors. They can understand about the polyvagal. So, Dr. Talia, what would you say to the audience, to the listeners, about how they could they do today to help themselves in their healing journey?
I think the biggest thing is learning to tune into your own intuition. Like, deep down, we might know, okay, like we've talked about all these different things, but like for someone, they might know in their heart, like I need to get some somatic acupuncture, or I'm ready to take some herbs, or I feel drawn to Reiki. Not to go, oh, okay, my friend said this is how she healed, this is what I have to do. To learn that healing is the connecting to our true self.
Beautiful.
And part of that journey is working out what our next right move is. And so there's many different things that all are value for someone, but they may or may not be for you. And to, each day tune into what you feel drawn to and follow that and trust that and take all the information like you get from even professionals. If it doesn't feel right in your body, if you're having a response, no, that's not the right thing, to listen to that, to put your, opinion first and foremost.
Beautiful. Thank you. That's profound. Really, really. And it's on the record. We have it here on the record. Dr. Aurora, I'd love to hear what you would want to leave with the listeners about what they could do today in their own life.
I think that my biggest hope is that people get a sense that what is happening in their that everything that happens to them is a physical event. All feelings, all chemicals, all emotions, they're all substances. And so if we can treat our body and its responses as an understandable, really useful sensory source, then we can engage more kindly with it. That the body is your own first child means that you should listen to it well and consider its responses as information that you can understand and respect and listen to, and that maybe they are not things you need to engage with, or maybe they are reactive, and you parent, you ideally would have a good understanding of your experience so far that you can see why a body might respond that way. But it would be most that I would want people to understand that their feelings are physical events and always should treat them like that.
Beautiful. Are you able to do virtual teletherapy sessions?
Yeah.
And help people and send them teas?
Yeah, absolutely. We have a program.
You're creating your own combination of different teas for certain parts of the nervous system?
Yeah, there are 25 teas, and we have a polyvagal system. So you work through the different polyvagal states. So there are 2 to 3 teas for each step in the process. But obviously those are the sorts of things we identify in working together, what it is a person needs. But there is a mini program where people can choose to work through those states on their own if they wish to. Without consultation, but that's because each of them I've researched to find their action on the polyvagal nerve, so you can choose appropriately. Yeah.
Amazing. So I'm going to leave. I'm going to put now on the TMS Roundtable, I'm going to put your website on there. Great. And maybe people can contact you and get questions. They can also questions on the YouTube, and we can send it to you. Your email will be on there. People know about Dr. Talia and your amazing book. Do you have a picture of your book before you leave with you?
Yeah, I do.
Could you just show your book, which is so in alignment with body wisdom. Yeah. Beautiful. All right, well, we'll meet again. There's so much to talk about. I would love to even. We could have a show for each tea, for each emotion. I mean, you're saying the emotion is physical, and pain is an emotion.
Yeah,
physical. An emotion is physical, and it's beautiful because this is part of the, it all draws together the work that I've started to get involved with. So I'm so thrilled. Yeah. Thank you, Steve, for saying hello. He was on our show 2 weeks ago. He started a big men's group about helping men with anxiety and stress. And I think, Steve, your men could drink this tea, and or can we roll this in a joint and smoke it? Honestly, the same herbs.
Yeah, that's right.
Wow. Okay.
Is it any way you liked? We've made them into things you can eat. We had protein balls of love and light for a while. There's all sorts of ways you can ingest them. We did look at, because there's all those terrible e-cigarettes. We looked at, could we make a smokable version? But it's still very difficult to see that the heat involved in lighting them interferes with some of the constituents and still has the potential for lung injury. Right. So
I think what's beautiful here, and what I think Dr. Talia will agree with, is we're going back to nature, and we're going back to what we know, and talk about source. We're really and the body is so smart and so full of wisdom, and so able to heal.
Yes, that's right.
Wow.
Jeez.
So I've talked enough for an hour, and I'm so happy to be here with you and start my morning. And we'll meet again. I think there's a lot to talk about here. And so I love you ladies. I'm so happy to be with you. And we'll thank you to the people that did come and listen. And I think there'll be more people that will be very interested to hear this. So have a wonderful day. And God bless
Thank
you. All. Bye.
Nice to see you. Bye.
Okay, 1 second. Okay.